Hi, good afternoon. This is Dr. Suresh Vatsyayann, and I'm going to tell you a little, only a little, maybe a minute, about diabetes. Before that, I'll tell you the definition of health, which I have come out with since 1995. Health is an ever-evolving state of mind, body, and relationships, perceived by an individual, a family, or a community for self in a particular time, space, and context. Health is not what others tell you. Nevertheless, the catch is that if you don't know, if you're not wise, if you don't know what actually inside happens in the body, how can you decide what's good for you and not good for you? And where I come, so many others come to teach you all the time about health, not about gimmicks, just the health. Diabetes is called blood sugar disease. Only two reasons, basic reasons. Either the insulin that burns the sugar to give us energy. Either the insulin that burns the sugar to give us energy is not sufficient enough to burn all the sugar we take in. And sugar doesn't mean sugar. Sugar means any food. Protein, fat, carbohydrates, all foods ultimately become sugar. And sugar then is burnt by insulin, mostly in the muscle cells, but in other cells also, to provide energy for us to live day to day as well as for a long time. That was the first reason, low insulin. For whatever reason, we'll talk about it later. Second reason is that wherever that insulin burns the sugar, there are receptors for the insulin, there is a gas chula. There is a cooking range that burns that gas or sugar. If it becomes resistant to the matchstick or the striker or the lighter, if that is not working, then in spite of the gas, it will not burn. So that means either insulin was low or there was resistance to insulin where it had to work. So the insulin receptors become resistant to insulin and hence the process doesn't start. I think this is enough for today, but we'll cover these things one by one, bit by bit, so that you know it. Thank you very much.